This is Friday, June 24th. This is Dan. Today we want to share some thoughts on the emerging world of medical contraindications with pharmaceuticals. That's a mouthful, I know, but we get 8 medical journals a month, and pharmacists and holistic MDs are agreeing on one thing, and that is that medications are robbing us of vital micronutrients. They've known for a long time that there's contraindications and side effects, but they're finding out through pharmacists all over the nation that almost every medication, because they're in a petrochemical category, they're robbing the body of vital nutrients. And what happens is that when vital nutrients are missing, a cascade of degenerative processes start to happen because of the side effects. It's continuing. Every year there's 105,000 deaths from what's called nosocomial infections and other things, iatrogenic causes, which just means in the hospital someone died of a medication that was properly prescribed. So there's side effects, there's damages to the organ systems, and there's robbing of vital nutrients from pharmaceuticals. So what's the solution? Well, if we're losing vital nutrients, the only solution is to replace those nutrients through clinical nutrition or quality supplementation. Just a few examples. When we take statins, which are now being prescribed like candy, even though the abundance of literature tells us there's significant problems with statins, cardiomyopathy, mental memory issues, breakdown of the liver enzyme challenges, muscle deterioration, muscle atrophy, blood sugar problems, they're still prescribing it like candy. Now, statins rob the body of a vital nutrient called coenzyme Q10, which affects the energy to the mitochondria of the cells. When we're robbed of coenzyme Q10, then muscle breaks down, the electrical current to the heart and the brain breaks down. So obviously we're doing great damage to the body, and there's natural alternatives, which we're not going to discuss today, but statins are one marked example of what a medication can do as far as robbing the body of vitally precious nutrients. With antibiotics, we're taking all of the beneficial bacteria from the gut, because antibiotics are indiscriminate. They kill bad bacteria and good bacteria. When we've lost the good bacteria in the gut, we're losing a lot of properties in our digestive system, leading to things like leaky gut syndrome, a lot of yeast buildup. We're not breaking down food and getting those micronutrients out to the cells like we're supposed to. So those cause a host of problems in the digestive tract. NSAIDs, that's just your over-the-counter pain killers like ibuprofen, Advil, Tylenol, all that family of acetaminophen, the family of supposedly harmless painkillers that years ago we actually thought they didn't cause any problems, and now medical science is telling us there's great problems with kidney function, liver damage, certainly gastrointestinal problems. Some of these NSAIDs rob the gut of prostaglandin, which protects the delicate lining of our stomach. So they're creating a whole host of problems and robbing the body of vital nutrients like B6 and the B family of vitamins. ACE inhibitors, beta blockers, your blood pressure meds. As soon as people get over 140, over 90 anymore, they want to throw a blood pressure med at us. What does that mean to us? It robs the body of zinc, a vital nutrient as far as our immune function. It also robs the body of the B family of vitamins. It reduces our energy level, can change our metabolism, put on a lot of weight all of a sudden, definitely change our moods. But ACE inhibitors, beta blockers don't get to the cause, and they don't cure the disease. They mask the symptom, but they have a host of side effects and contraindications. SSRIs, some of the most widely prescribed meds in history. Your serotonin uptake inhibitors. Those are your Prozac, your Zoloft, your Wellbutrin, your Effexor, the whole host of mind-altering medications that they're trying to control serotonin, trying to control through medication the moods that are a normal response to life's everyday stressors. Well, selective serotonin retake inhibitors, those are disturbing our thyroid function. They're causing great changes in metabolism and mood, as we mentioned before, leading to depression and a difficult balancing act as far as trying to stabilize serotonin through a chemical cocktail instead of trying to stabilize serotonin naturally as we would indeed like to if possible. With diuretics, in the old days we thought if we had fluid retention, the legs were swelling up. They looked at pulmonary function, cardiac function, then they looked at a host of other reasons for fluid retention. And what they started doing was giving diuretics and trying to remove that fluid from the body when they found out maybe the reason we're storing fluid is that we are so severely dehydrated and lacking in fluid. So the moment they give us those diuretics, then we're depleting the body of minerals, precious minerals like calcium, magnesium, potassium, and phosphorus, leading to bone mass loss, cramping, cardiac arrhythmias, the things we don't want. We're losing vitamin C when we take diuretics, a vital antioxidant and immune function and skin, connective tissue, collagen benefits. We lose those. So why don't we as proactive consumers start asking more questions? We are not your doctor. We're not telling you to go off medications, but we're telling you as a proactive consumer to consult your physician's desk reference, do your homework, find out not only what are the side effects and what are the contraindications, but what vital nutrients am I being depleted of because I'm on a new petrochemical, if that makes sense, everyone. Hormone replacement therapy, in the old days the doctors would give Premarin and Prempro like candy, and then after 40 years of data they found out that we're seeing an increase in fibrocystic disease, heart disease, breast cancer, and maybe they turned out to be dangerous indeed. So now women are looking at bioidentical hormones and natural hormone balancing because the old synthetic hormone replacement therapies depleted our body of all of its beneficial bacteria in the gut. It led to a loss of many vital nutrients, and fibrocystic disease was on the rise. So we want to address these things naturally, but we want to be aware of what vital nutrients are they robbing us of. Finally, in diabetes, hypoglycemia, type 1, type 2, with glucophage, metformin, and the family of new blood sugar medications, which again are very hard to stabilize and control. The doctors want to, as much as possible, try to get A1C and morning readings under control, but it's a guessing game again. But we're robbing the body with these medications of hemoglobin, vital red blood cell component of our blood, reducing the level of hemoglobin and coenzyme Q10, leading to the same problems we saw with statins, but drastically affecting our red blood cell count and our lab values. So anemia, chronic fatigue, other things, memory loss, cardiac arrhythmias are also affected by the type 2 medications. So in the final analysis, what we want to do is be good educators and good researchers. We want to find out if you and I have been prescribed a med, let's at least know A, the side effects, B, the contraindications, and C, what nutrients do we lose in taking these meds and what nutrients do we need to replace with. So from our end, you would expect us to say we look at supplementation, clinical nutrition to replace those vital nutrients and be a wise consumer. That's all for today. Thank you very much.